Central sleep apnea represents one of the most complex and challenging sleep disorders affecting millions of individuals worldwide. Unlike its more commonly recognized counterpart, obstructive sleep apnea, central sleep apnea originates from neurological dysfunction rather than physical airway obstruction. This condition occurs when the brain temporarily fails to send appropriate signals to the muscles responsible for controlling breathing during sleep, resulting in repeated episodes of breathing cessation that can last from seconds to minutes throughout the night. The pathophysiology of central sleep apnea involves intricate mechanisms within the respiratory control centers located in the brainstem. These neural networks continuously monitor carbon dioxide levels, oxygen saturation, and pH balance in the blood, automatically adjusting breathing patterns to maintain homeostasis. When these control systems malfunction or become hypersensitive, they can trigger inappropriate responses, causing breathing to stop entirely or become extremely shallow. This neurological disruption distinguishes central sleep apnea from mechanical breathing difficulties, making it particularly challenging to diagnose and treat effectively. Medical professionals classify central sleep apnea into several distinct subtypes, each with unique characteristics and underlying causes. Primary central sleep apnea, also known as idiopathic central sleep apnea, occurs without any identifiable underlying medical condition. Cheyne-Stokes respiration represents another significant variant, characterized by cyclical patterns of gradually increasing and decreasing breathing effort followed by periods of complete apnea. This particular form frequently accompanies congestive heart failure, stroke, or other serious cardiovascular conditions. Treatment-emergent central sleep apnea, sometimes called complex sleep apnea syndrome, develops in patients initially diagnosed with obstructive sleep apnea who subsequently manifest central apneic events during continuous positive airway pressure therapy. The clinical presentation of central sleep apnea often differs substantially from obstructive sleep apnea, creating diagnostic challenges for healthcare providers. Patients typically report frequent nighttime awakenings, insomnia, morning headaches, and excessive daytime fatigue. However, the characteristic loud snoring commonly associated with obstructive sleep apnea may be absent or significantly reduced in central sleep apnea cases. Instead, patients might experience witnessed breathing pauses, gasping episodes, or irregular breathing patterns during sleep. Cognitive symptoms, including difficulty concentrating, memory problems, and mood disturbances, frequently accompany the physical manifestations of this disorder. Comprehensive diagnosis of central sleep apnea requires sophisticated sleep study equipment and specialized interpretation by qualified sleep medicine professionals. Polysomnography, conducted in accredited sleep laboratories, remains the gold standard diagnostic tool. During these overnight studies, multiple physiological parameters are continuously monitored, including brain activity, eye movements, muscle tone, heart rhythm, oxygen saturation, airflow, and respiratory effort. The absence of respiratory effort during apneic episodes definitively distinguishes central sleep apnea from obstructive events. Advanced diagnostic criteria require specific apnea-hypopnea index thresholds and detailed analysis of breathing pattern characteristics throughout different sleep stages. Treatment approaches for central sleep apnea vary significantly depending on the underlying etiology, severity of symptoms, and individual patient factors. Positive airway pressure therapies, including continuous positive airway pressure, bilevel positive airway pressure, and adaptive servo-ventilation devices, represent primary therapeutic interventions. Adaptive servo-ventilation technology specifically targets the irregular breathing patterns characteristic of central sleep apnea by providing variable pressure support based on real-time breathing pattern analysis. However, certain patient populations, particularly those with advanced heart failure and reduced ejection fraction, may experience adverse outcomes with specific ventilation modalities, requiring careful patient selection and monitoring. Pharmacological interventions offer alternative or adjunctive treatment options for selected central sleep apnea patients. Acetazolamide, a carbonic anhydrase inhibitor, can help stabilize respiratory control by creating mild metabolic acidosis, thereby stimulating consistent breathing drive. Theophylline, traditionally used for asthma management, has demonstrated efficacy in reducing central apneic events through its respiratory stimulant properties. However, medication-based treatments generally provide modest improvements and may be associated with significant side effects, limiting their widespread application in clinical practice. Lifestyle modifications and optimization of underlying medical conditions play crucial roles in comprehensive central sleep apnea management. Weight loss, when appropriate, can reduce overall sleep-disordered breathing severity. Avoiding alcohol and sedating medications, particularly before bedtime, helps prevent further respiratory depression. Sleeping position optimization, maintaining consistent sleep schedules, and creating optimal sleep environments contribute to overall treatment success. For patients with heart failure-related central sleep apnea, aggressive management of cardiovascular conditions, including optimization of cardiac medications and fluid balance, often leads to significant improvements in sleep-disordered breathing. The long-term health consequences of untreated central sleep apnea extend far beyond sleep quality deterioration. Chronic intermittent hypoxemia and sleep fragmentation contribute to increased cardiovascular morbidity and mortality. Patients face elevated risks of hypertension, cardiac arrhythmias, stroke, and progression of existing heart failure. Metabolic consequences, including insulin resistance and glucose intolerance, frequently develop over time. Cognitive impairment, depression, and reduced quality of life represent additional significant burdens associated with inadequately treated central sleep apnea. Recent advances in sleep medicine research continue expanding our understanding of central sleep apnea pathophysiology and treatment options. Novel therapeutic approaches, including phrenic nerve stimulation devices, offer promising alternatives for patients who cannot tolerate traditional positive airway pressure therapies. These implantable devices stimulate the diaphragm directly, maintaining consistent breathing patterns throughout sleep. Ongoing clinical trials investigate new pharmacological agents, combination therapies, and personalized treatment algorithms based on individual patient characteristics and central sleep apnea subtypes. The prognosis for central sleep apnea patients varies considerably depending on underlying medical conditions, treatment adherence, and individual response to therapeutic interventions. Early diagnosis and appropriate treatment implementation significantly improve outcomes, reducing both symptoms and associated health risks. Patients with heart failure-related central sleep apnea may experience improvements following optimization of cardiac management, while those with primary central sleep apnea often require long-term positive airway pressure therapy. Regular follow-up care, including periodic sleep studies and device monitoring, ensures optimal treatment effectiveness and allows for timely adjustments based on changing clinical circumstances. Healthcare providers emphasize the importance of comprehensive patient education regarding central sleep apnea management, treatment options, and long-term health implications. Understanding the chronic nature of this condition helps patients develop realistic expectations and maintain treatment adherence over time. Support groups, online resources, and ongoing communication with sleep medicine specialists provide valuable resources for patients navigating the complexities of central sleep apnea management throughout their lives.